Urine examination, and as we had discussed in the class, urine examination has three aspects. One is the physical examination, the chemical examination, and the microscopic examination. Right? So in physical examination, you look at the volume of urine, what is the color of the urine, what is the smell of the urine, right? Which you are not required to perform here, but what you want to perform is the chemical. More important is to interpret the results. Because once you become doctors, you will not be required to perform this test. You get a urine report which you should be able to interpret to what it is. And you should be able to know as to what is the next step that you have to take. We also know that the test we perform is going to be called the heat test, in which the urine is collected in a test tube. The top of the test tube is heated, and we look for development of turbidity. So if there is turbidity, we know there is protein. Mainly they are the phosphate salts which are included in urine that can produce turbidity and can be wrongly interpreted as or protein in the urine. So once turbidity is produced, we drop 2-3 drops of acetic acid on the and see whether the turbidity stays or disappears. The other question is, why do we need to heat the top of the test tube? Why don't we heat the bottom of the test tube? The point is this, that if you heat the bottom of the test tube, the convection currents will run from the bottom to the top of the test tube and mix up the entire urine volume. But when you heat the top of the test tube, the convection currents don't go on down. They always rise on top. So they are limited to the top of the test tube, and the bottom of the test tube remains as it is, and you get to compare. Generally, the method that is used to perform tests to detect glucose in urine in most of the labs. There are some rapid tests which are done on the urine to detect glucose and proteins, which are done by using strips, which are known as dipsticks. Dipstick uses the glucose oxidase method. It is specific for glucose, whereas the Benedict test that we do is not specific for glucose. So you must know how the diabetic destroys or damages the organs. So these are the common questions. So it is just not a matter of performing the test, it is a matter of interpreting